RNA. So this is the ribosomal RNA, and these coloured objects are the assembly factors, which all lie on this surface of the large ribosomal subunit. And what needs to happen is that all these factors need to be released to open up this this space on the large ribosomal subunit to allow it to join with the small or 40S ribosomal subunit. So what goes wrong in Shwachman-Diamond syndrome is that the SBS or indeed the EFR1 protein in some cases is deficient, and as a result EIF6 gets stuck on the surface of the large ribosomal subunit, and these two subunits can then no longer come together. So there's a joining defect, as it's termed, and this reduces the amount of mature, actively translating ribosomes in the cell, and the cells make less protein, and that's why we see the different clinical phenotypes. It's as a result of the reduction in protein synthesis in the cell. So this, following the release of EIF6, the mature 60S joins with the 40S to form this machine, this actively translating ribosome, which then makes all the proteins in the cell. And so why is that important? And the reason is apparent from this structure from Sebastian Klinger. So this is the small subunit, the large subunit, and here's EIF6 on the surface. And as you can see, there's a clash. So the EIF6 protein sits right at the junction between the large subunit here on the right and the small subunit on the left. So it forms a barrier to the assembly of these two subunits into an actively translating ribosome. So it needs to be removed in order to allow the assembly of productive ribosomes, things that will make protein efficiently. Move to that. Is precision medicine possible for SDS by trying to design so-called EIF6 suppressor mimics? And I just want to show you
the final 3D image of the ribosome, complete with troublesome yellow lump, a protein that's meant to break off but gets stuck, causing a rare but dangerous condition called Shwachman-Diamond syndrome.
It's exciting we have these new technologies, the new microscope facility.
In his Cambridge lab, Professor Alan Warren is using the pictures to find a drug treatment. Like testing keys for a lock, it's about matching up the shapes.
So you literally need to zoom into here and see the shape that you're trying to find. You're looking for a drug to fit that shape effectively.
Correct. So the idea is that we could find a drug which might sit at the interface between this protein and the rest of the ribosome. So we want to find something that will get into the groove and knock off this protein from the surface of the ribosome. Whether by adding some of these molecules can we rescue the development of the fly. And here we can see that compared to the control or just the vehicle, which is the solvent that we use to dissolve the compound, we can see a considerable, we can see a rescue of the proportion of flies that develop to the pupal stage, and so this was very exciting to us. And any other patients with a mutation which is currently unknown, but it's possible there are other patients where the mutation is affecting another component of the assembly pathway. But the sort of common downstream consequence of that is likely to be failure to release EIF6 from the ribosome. So we would hope that such a molecule might be able to help all the families. Trying to do with such a therapy. The concept is that we could restore ribosome homeostasis, so the balance of protein synthesis in all cells. So does that answer the question? So we'd hope that we could target the blood system, but also targeting cells beyond blood, hopefully. So yeah, I would hope so. That's the plan. Yeah. So yeah, we have good intentions to try to do this as fast as we can, with the support from these venture capital community. Then hopefully that'll expedite progress. But yeah, I can't make any guarantees. But we'll work as hard as we can to try to bring this to clinical trial.